Let me take you inside the human heart for a moment, not just as a muscle, but as a miracle of rhythm. Imagine it beating in perfect harmony, a conductor of life's orchestra, four chambers working in seamless coordination, generating a pulse that gives you life, breath, movement, clarity. Now imagine that conductor suddenly loses the rhythm. The orchestra falls out of sync. That's what happens in atrial fibrillation. It's not just a medical condition. It's your body's way of saying something is out of balance. Atrial fibrillation, or AFib as we call it, isn't some obscure problem that affects a rare few. It's the most common heart rhythm disorder in the world, especially as we age. And yet, most people don't even know what it is, or worse, they mistake its symptoms for stress, fatigue, or just getting older. But AFib is not something you ignore. It's not something you hope will go away, because when the heart is out of rhythm, everything else, your energy, your circulation, your oxygen, falls out of sync too. Let's get to the root of it. Your heart runs on electricity. Tiny signals start in the atria, the upper chambers, and tell your heart when to contract. In normal rhythm, these signals are orderly, like a metronome. But in AFib, that electrical system short circuits. The atria start to quiver, fibrillate, causing an erratic heartbeat. Instead of that steady lub, dub, it becomes a chaotic flutter. That disorganized rhythm doesn't just feel unsettling. It compromises how well your heart can pump blood. And that's where real danger lies. Now, people often ask me, is it painful? Well, I feel it. And the answer is not always. Sometimes, yes, you'll feel your heart racing, pounding like it's running a marathon when you're just sitting still. Other times, the signs are deceptively subtle. Fatigue that seems out of proportion, a vague sense of unease in your chest, dizziness, shortness of breath, or feeling like your thoughts are fuzzy or far away. These are signs that your heart isn't pumping blood, and therefore oxygen, to your brain and body the way it should. Your body is talking. The question is, are you listening? What's remarkable is that this chaotic rhythm can come and go. You might have episodes that last a few minutes, or hours, or longer. That's called paroxysmal AFib. But over time, it can become persistent. And if left untreated, it can lead to permanent AFib, where the rhythm never returns to normal without medical intervention. The longer AFib stays, the more it remodels the heart, literally changing its structure. That's when the risk of serious complications like stroke, heart failure, even dementia skyrockets. And here's the part I want you to really understand, not with fear, but with clarity. AFib increases your risk of stroke by 5 times. Why? Because when the atria quiver, they don't push blood out efficiently. Blood pools, clots can form, and those clots can travel straight to the brain. One moment you're sipping tea, the next you can't move your arm or speak clearly. But this is preventable if we act early, if we're aware. That's why awareness is so important. You don't need to be a cardiologist to feel your pulse. If it's fast and irregular, even if you feel fine, get it checked. We live in an era where you can wear a smartwatch that tells you your heart rhythm in real time. That's incredible. But technology isn't enough unless you pay attention. Awareness only helps those who are willing to listen. Now, I know some of you are thinking, but I feel fine most of the time, and I understand. But let me offer you this perspective. The body often whispers before it screams. And atrial fibrillation whispers with every irregular beat. It's a reminder to slow down, to tune in, to investigate the things that don't feel quite right, not just physically, but emotionally and mentally as well. Stress, poor sleep, alcohol, certain medications, even dehydration, these can all tip your heart into AFib. It's a fragile balance, but fragility doesn't mean weakness. It means you have an opportunity to intervene, to catch the storm before it builds. That's not fear-based thinking. That's empowered thinking. That's medicine meeting mindfulness. So let's reframe what it means to be healthy. It's not just the absence of disease. It's the presence of rhythm, not just in your heartbeat, but in your lifestyle, in your daily choices, in how you respond to what your body is telling you. Atrial fibrillation isn't a life sentence. It's a wake-up call. And the earlier you answer, the more control you reclaim. S, The greatest rhythm isn't measured in beats per minute. It's measured in how you live, how you love, and how closely you're listening when your heart speaks. Let's talk about signs. Those little signals your body sends when something's out of balance. They're easy to miss because we're conditioned to push through, to rationalize discomfort, to write off symptoms as stress or aging or just one of those things. But when it comes to atrial fibrillation, missing those signs can be a costly mistake. AFib doesn't always walk in with a dramatic entrance. It doesn't always knock you over with pain or collapse. More often, it tiptoes in. It hides in your everyday fatigue, your occasional dizziness, that vague tightness in your chest you chalk up to anxiety or skipped meals. But let me ask you this. When was the last time you sat still, placed 2 fingers on your wrist or neck, and truly felt your pulse? Not just that it was beating, but how it was beating. Was it steady or erratic? Was it slow and strong or rapid and uneven? Because sometimes the only real clue your heart gives you is rhythm. It's subtle music becoming disjointed. I've seen patients who lived with undiagnosed AFib for years, people who attributed shortness of breath to being out of shape, who ignored a racing heartbeat at rest because they assumed it was stress. One man even told me he thought the palpitations were just his body revving up from caffeine. But let me tell you, AFib isn't something you feel only when you're doing something strenuous. It often strikes when you're doing absolutely nothing, watching television, reading a book, lying in bed. And that unpredictability is what makes it dangerous. We tend to associate heart problems with pain, sharp chest pain, the classic sign of a heart attack. But atrial fibrillation rarely presents that way. It's not about pain. It's about confusion, disorientation, that feeling that something isn't quite right. Your energy dips unexpectedly. You feel winded walking up a flight of stairs that never used to bother you. You experience what I call gray moments, where your focus blurs, your thoughts slow, and you feel disconnected from yourself. These aren't random moments. They are physiological red flags. Now, here's something that needs to be said, especially to those of you who pride yourselves on toughness and endurance. Ignoring symptoms is not strength. Denial is not resilience. True strength lies in being honest with your body and courageous enough to investigate discomfort, not push through it blindly. Because atrial fibrillation doesn't just affect the heart, it affects blood flow to the brain. And when your brain isn't getting what it needs, everything from memory to mood to coordination can suffer. I want you to understand how deeply interconnected these systems are. Your heart isn't an isolated pump. It's in constant dialogue with your lungs, your nervous system, your hormones. When the rhythm goes off track, that conversation gets garbled. Your body works harder to compensate, your organs strain. And over time, that compensation becomes exhaustion. We see people develop cognitive changes, not because of age alone, but because of silent, undiagnosed AFib leading to reduced cerebral perfusion. That means your brain is literally being starved of oxygen-rich blood. It doesn't happen overnight, but it does happen. So how do we start to catch it early? We learn to listen differently, not with panic, but with presence. If your heart is skipping beats, if you feel a flutter in your chest, if you experience sudden bouts of tiredness that seem out of sync with your activity level, don't ignore it. If you find yourself sitting quietly and suddenly your heart feels like it's running a race, don't assume it's just nerves. Get it checked. There's no prize for waiting until it's too late. And this isn't just for older adults. We're seeing AFib appear in younger populations, partly because of lifestyle factors, poor sleep, alcohol consumption, dehydration, high caffeine intake, even extreme endurance training without proper recovery. These can all disrupt your heart's electrical system. You don't have to be elderly to be vulnerable. You just have to be unaware. I'm not telling you this to alarm you. I'm telling you this to empower you. Because once you know what to look for, once you tune into your body's rhythm, you begin to build a new kind of health literacy. One that doesn't rely solely on symptoms screaming for attention, but on subtle intuition, informed awareness, and proactive curiosity. Health is not a guessing game. It's not about hoping things go away. It's about seeking clarity, being responsive, not reactive. And most importantly, it's about acting on the signals your body sends before they escalate into crisis. So here's the truth. The greatest signal your body can give is not a loud alarm, but a soft whisper. Learn to hear it. Because silence does not always mean peace, and a quiet symptom can sometimes be the loudest warning. Let's explore something that's often misunderstood, the risk behind atrial fibrillation that doesn't feel like an emergency. People hear AFib and imagine it's just a fast or irregular heartbeat, but underneath that surface irregularity lies a far more silent, insidious danger, the formation of blood clots. And that's where the real threat lies, not in the flutter, but in what the flutter can set in motion. See, when your heart isn't beating in a coordinated rhythm, when the atria, those upper chambers, are quivering instead of contracting efficiently, blood can begin to pool. And stagnant blood, much like stagnant water, creates the perfect environment for clot formation. Once a clot forms, it can break off and travel through your bloodstream. If it lodges in the brain, we call it a stroke. If it blocks a vessel in the lungs, it's a pulmonary embolism. And in both cases, the consequences can be devastating. Paralysis, cognitive decline, sudden death, all because of a condition that many people dismiss as just an irregular heartbeat. Now, here's the philosophical layer we must uncover. Human beings tend to react most strongly to what we can feel. We fear pain, panic at sharp discomfort, respond to dramatic symptoms. But AFib teaches us an uncomfortable truth. Not all danger feels dangerous. Some of the most life-threatening processes in the body give you no pain, no warning, just silence. The real test, then, isn't how quickly we react to pain. It's how wisely we respond to subtle dysfunction. That's the discipline of modern health. This is why anticoagulant therapy is such a vital part of AFib treatment. These are medications designed to thin the blood, reducing the chance of clots forming in the first place. They don't change the rhythm of the heart, but they dramatically lower the risk of stroke. In fact, studies show that properly prescribed blood thinners can reduce stroke risk by up to 70% in patients with AFib. That's a life-altering statistic. Yet many patients resist these medications, afraid of side effects, of bleeding, of the label that comes with being on a blood thinner. But here's what I ask them. What is the cost of inaction? What's the cost of fear? Yes, bleeding is a risk, but we can monitor that. Yes, you might need to adjust your lifestyle slightly, but what's more disruptive to your life? A few changes in routine or a stroke that leaves you unable to speak or walk. It's not about trading one fear for another. It's about weighing risks with wisdom, not emotion. This is where patient education becomes transformative. When you understand what your medications are doing, not just that you're taking them, but why, you're more likely to stay consistent. You become an active participant in your own prevention strategy. And that shift, that sense of agency, is psychologically powerful. It turns helplessness into partnership. It turns fear into informed action. There's a kind of spiritual clarity that comes when we acknowledge that prevention isn't glamorous. It doesn't come with fireworks or applause. It's quiet. It requires humility. It asks you to protect yourself from something that hasn't happened yet. But that's where wisdom lies, between the now and the not yet. To accept the invisible danger of a clot forming in the dark chambers of the heart is to live with awareness. To treat it, even before a symptom appears, is to live with foresight. And let's be clear, this isn't just about medication. It's about creating an ecosystem in the body that doesn't invite clot formation. Hydration, movement, good sleep, stress reduction, all of these play a role. Your blood is a living river, and the more fluid, oxygenated, and stress-free that river is, the less likely it is to stagnate and clot. So think beyond the pill bottle. Think holistically. Blood thinners are vital, yes, but they're part of a larger story. One where lifestyle and pharmacology are not rivals, but partners. We have to stop treating the body like it's a series of disconnected compartments. The heart is not isolated from the brain. The blood is not separate from the spirit. A stroke is not just a vascular event. It's a rupture of potential, a breaking of continuity in your life's journey. Preventing that rupture is one of the most sacred responsibilities we have to ourselves and our families. So if you or someone you love is living with AFib, don't wait for the crisis to come knocking. Don't assume that feeling okay means you are okay. And don't let fear of treatment outweigh the danger of inaction. Knowledge gives you options. Action gives you power. But consistency, that gives you protection. Thus, the greatest victories in health often come from preventing what never had to happen. And that, my friends, is the quiet triumph of wisdom over chance. Let's talk about something that often gets pushed to the sidelines when we discuss atrial fibrillation, its connection to lifestyle. You see, we tend to approach heart conditions with a very mechanical mindset. Something's off. We fix it with medicine, with procedures, with pacemakers if necessary. But the heart doesn't operate in isolation. It's not a machine that malfunctions in a vacuum. It's a living, breathing mirror of how we live, what we eat, how we move, how we sleep, how we manage stress, and most importantly, how we care for the deeper rhythm of our lives. Atrial fibrillation doesn't just randomly show up one day and surprise you. It evolves. It grows silently in the shadows of years of silent inflammation. Blood pressure that climbs too high and stays there, weight that slowly accumulates, sleep that erodes, and stress that becomes a chronic background hum. These are not isolated choices. They are cumulative patterns. AFib is often the body's way of waving a red flag, signaling that the tempo of your life has become unsustainable. Let's start with weight. Research shows that obesity is one of the strongest modifiable risk factors for developing atrial fibrillation. Excess fat, especially visceral fat around the abdomen, doesn't just sit there quietly. It becomes metabolically active. It releases inflammatory cytokines that fuel a chronic, low-grade fire in the body. This inflammation alters the electrical properties of the atria, making them more susceptible to chaotic rhythms. When we lose weight, not just to look better, but to feel and function better, we actually reduce the size of the left atrium, lower the inflammatory load, and decrease the risk of both developing and sustaining AFib. This is not just theory, it's documented reality. Then there's sleep. Sleep apnea, in particular, is a stealthy contributor to atrial fibrillation. When you stop breathing dozens of times a night, your oxygen levels plummet and your heart gets jolted awake repeatedly like a fire alarm in the middle of the night. This causes a surge in sympathetic nervous system activity, the fight or flight hormones, and over time, that heightened state becomes the new normal. The heart, constantly stimulated and deprived of rest, begins to lose its rhythm. The good news is that treating sleep apnea with weight loss, CPAP, or even just better sleep hygiene can reduce AFib episodes dramatically. Let's not forget stress. You don't need a study to tell you that emotional turbulence affects your heartbeat. You felt it. Heart racing during an argument, skipping beats when you're anxious, pounding in your chest when you're overwhelmed. Chronic stress changes your biochemistry. Cortisol rises. Blood pressure spikes. Your body begins to treat everyday life like a battlefield. And just like with sleep, the electrical system of your heart doesn't operate independently of your emotional state. Long-term stress creates a fertile ground for arrhythmias. Mindfulness, meditation, breathing exercises, these aren't spiritual fluff. They're cardiac medicine. They restore tone to your vagus nerve, which slows your heart, calms your system, and anchors you in a state where normal rhythm is possible again. And then there's movement. Not excessive, punishing workouts, but consistent physical activity, the kind that makes your heart stronger, your blood vessels more flexible, your insulin levels more stable, and your mood more balanced. Moderate exercise improves autonomic balance, reduces resting heart rate, and supports the integrity of your cardiac conduction system. When your body is conditioned to handle physical stress, it also becomes better equipped to resist internal electrical chaos. This is why lifestyle isn't a side dish in the treatment of atrial fibrillation. It's the main course. Medications and procedures are important, but they work best when laid upon a foundation of healthy daily practices. You can't out-medicate a toxic lifestyle. And here's where the philosophical depth really matters. Lifestyle change isn't about guilt or willpower. It's about identity. It's about deciding who you want to be in relationship to your own heart. Are you going to be a passive recipient of disease or an active steward of your health? When we shift from thinking of our heart as a problem to be fixed to a partner to be supported, everything changes. The food we eat becomes fuel, not filler. Sleep becomes sacred. Movement becomes a form of gratitude, not punishment. Stress becomes a signal, not a sentence. These shifts are subtle, but they reshape our biology in profound ways. Your heart learns from your choices. It adapts. It heals. It regains rhythm, not just through medicine, but through meaning. So if you're facing AFib or trying to prevent it, don't just look at your prescriptions. Look at your plate. Look at your calendar. Look at the thoughts that dominate your mind and the way your body feels when you wake up each day. Because atrial fibrillation is not just an electrical issue. It's a reflection of imbalance. And restoring balance starts not in the emergency room, but in your kitchen, your bedroom, your breath. In the end, rhythm is not just about the heartbeat. It's about how your life beats with it. Restore the rhythm in your choices, and the heart will follow